And a dynamic application is one that learns about the person who's applying as the application moves forward and uses that information to make sure that that applicant only sees the questions that apply to them. So if a man is filling out the application and indicates earlier in the application that he's male, he's not going to get questions about pregnancy. Or if it looks like a family will be eligible for Medicaid, they aren't going to be asked questions about whether or not they can get coverage through a job because that doesn't apply to them within the Medicaid program. So HHS estimates that this dynamic capability of the online application will mean that each applicant has to answer less than a third of the possible questions on the application. So that's a big saver of time and make sure that people don't have to fill out things that aren't necessary. The second great thing about this online application is that it's been heavily consumer tested. HHS has gone around the country and sat down with consumers who are likely to be eligible for Medicaid or for tax credits in the exchanges and had them work through the application and taken note of, what are words that trip people up, what are good ways to phrase questions, and even, what's the best way to order things in a way that makes sense to consumers. So they've done a lot to eliminate jargon and make sure that the application is set up in a way that will really help people move through it and have success in filling out the application. So once the application is filled out and submitted, the applicant will get their eligibility determination. And what happens next depends on what coverage they're eligible for. So if that person gets Medicaid, they go ahead and enroll in Medicaid and their coverage starts right away. If they're going to be eligible for tax credits or to buy a plan in the marketplace, they still need to do another step, which is choosing the health plan that they're going to enroll in. And we know that choosing a health plan is something that can be very difficult and stressful for consumers, and people have had a lot of good reason to be concerned about that process before the Affordable Care Act. They ask questions like, if I have a pre-existing condition, will I be able to get coverage, or will that coverage be excluded from my plan, or will I have to pay more in order to purchase coverage? It can also be hard for people to find out what benefits are included in their plan, since many health plans currently do exclude some services that most people will need at some point. It can also be hard to choose between plans because they each provide their information differently, so comparing and sort of figuring out what your best option is can be really difficult. The Affordable Care Act makes this process much easier in three ways. First of all, it prohibits plans from denying people based on pre-existing conditions. So if an applicant has a condition or has had breast cancer in the past, they can go into this process of picking a plan knowing that that will be covered under any insurance plan that they pick, that they can't be denied based on that condition, and that they're not going to be charged higher premiums because of that. The second important way that plan selection is easier under the ACA is that all plans that are sold on the marketplace will now have to cover a set of essential benefits. So right now, some plans don't cover important things like maternity care or prescription drugs or mental health care. Under the Affordable Care Act, every plan in the marketplace has to cover a set of 10 basic essential benefits. Includes things like prescription drugs, lab services, hospitalization, emergency care, mental health care, maternity coverage. So that can give people real peace of mind as they're shopping for a plan, knowing that no matter what they choose, those basic services are going to be covered. The third way that the ACA makes picking a plan easier is that the application will have the same information about each plan set up side by side so people can make a real evaluation of what's best for them. And it'll provide information that's really relevant to consumers. So, for example, somebody who has a chronic disease and uses multiple prescriptions might be interested in finding which plan covers the most of the cost of prescription drugs. Or somebody with a really close relationship with a particular doctor or specialist might want to check and make sure that the plan that they're choosing includes that doctor within the plan's network. And there will also be a calculator with that in this plan comparison section that will help consumers see, okay, this is how much choosing this plan is going to cost me each month.